before we go into Taiyin disease, because as now we're getting more and more damp, right, in the coughs and stuff. So then, before we go into Taiyin disease, I want to mention one more formula that's actually really, really good for coughs and stuff like that. And it's a little bit the formula that I'm now developing into myself, which is just a Bancha Sheishin Tang. And thank God I have a bottle with me. Never leave home without it. Bancha Sheishin Tang has Huangqin Huanglian. So the fact that it has Huangqin means it is still treating Xiaoyang. It is still harmonizing Xiaoyang. Right? It is still working on the Xiaoyang aspect like a Huangqin Tang Xia Cai Hu Tang did. Right? So you're still treating Xiaoyang. But you're also treating Yangming because you're using Huanglian. Right? So there's Huanglian in Bancha Sheishin Tang. So it helps with the Yangming. So then you just need to do one thing. You need to add Gualo to your Bancha Sheishin Tang, and you have a Xiaoshenxiong Tang. Right? Because your Xiaoshenxiong Tang is Gualo, Bancha, and Huanglian. And you already have Huanglian and Bancha in your Bancha Sheishin Tang. So all you have to do is add Gualo. And adding Gualo to Xiao Cai Hu Tang is a standard Zandongjing modification. So adding Gualo to Bancha Sheishin Tang is a standard modification. Because Bancha Sheishin Tang is a modification of Xiao Cai Hu Tang. Right? So it's really beautiful that way. So that's typical when you have some cold, but also some warm. Some wet, but also some dry. And because it's a formula that treats a glomus, a P, and a P or a glomus is often due to mistreatment of an initially simplex pattern. It is one of the most common formulas to use when people have tried all kinds of over-the-counter things and whatever other things to get over their cough. Because the pattern has become more complex and complicated. Right? So that's a typical Bancha Sheishin Tang pattern. So Bancha Sheishin Tang. So then you can do the following. And that's what I often do. Bancha Sheishin Tang minus Rinchen Dazao, because Zandongjing says if cough, take Rinchen Dazao out. Right? So Bancha Sheishin Tang minus Rinchen Dazao plus Wu Weizi, because Ganjiang Wu Weizi for cough. Right? If there's some yellow sticky phlegm and dryness in the back of the throat and those kinds of things, plus Gualo. So you have your wind phlegm aspect of your Xiaoshenxiong Tang. And if there is a little bit of peripheral heat or heat in the face, heat in the nose, dryness in the nose, dryness of the eyes, redness of the eyes, you can also add Guggen. And then you actually have Guggen Qinlian Tang. Right? Bancha Sheishin minus Rinchen Dazao plus Wu Weizi plus Gualo and Guggen. And you're still really protecting the spleen because you still have Ganjiang, Bancha, Zhiganzhao, you still have a lot of work for the spleen in there. But you're not actually adding the extra moisture of the Rinchen Dazao. And you're still able. And that's for very complex types of cough, where especially the type of phlegm is very sputumy, very frothy and sputumy. It almost looks like saliva, but like more white, and the bubbles in the saliva are smaller. More like almost, it's not really a froth, but almost like a frothy-like type of phlegm that comes up, which you see very often. It's mostly what I get ultimately because when I teach a lot, right, you're losing your young, right, and then you get more, like my tendency is more to go towards the damp side of the equation. I'm not like a dry constitution. I'm more of a wet constitution, right? So then, I get damp in the center, and that's pretty straightforward. And then also, I can get damp in the center also just because, whenever I'm teaching, I'm on the road, I'm always eating at restaurants, right? So it's always richer than it has to be, 3 meals a day, right? Because I'm on the road for 2 weeks, whatever, right? But when I'm teaching, I've got so much constant airflow through my nose and my mouth that this area really dries out. So I've got dryness and hot on top, and I've got dampness and cold in the center. So it becomes this mixed pattern, right? So if on top of that, if I do any type of alcohol or anything excess like that at night, if.
I mean when?
Maybe.
Sorry.
then no, it's fine. Then then it heats up, and then you bet that I'm gonna be in that kind of situation with heat and cold, with damp and dry, all mixed in. So then you go with that kind of bancha sheshing tang. And actually, this season I've seen a lot of them already with patients, because the weather has changed. They've all had a shao cai hutang. They didn't come in. Then it went into their chest, right? Then they had Thanksgiving dinner. Then you know what I mean? Like all the cookies and all the whatever stuff comes into play and all that, and it gets quite mixed up. And then they've tried a few treatments like over the counter and things like that. And some even say, "Oh, I went to the sauna, tried to sweat it out." Well, are you trying to sweat your phlegm out? What are you doing? Like it makes it thicker, it makes it stickier, it makes it hotter, right? I mean, all of those things.